Hi guys, and welcome back to People's Digest. Welcome back to the second part of the Caesarean Section Series. In this video, I'll be telling you what to expect when you arrive on the antenatal ward in preparation for your planned Caesarean section. If you haven't seen part 1, I will link it in this video, and if you're interested, please check it out. So on arrival on the antenatal ward, you'll be greeted by a midwife or the team of midwife who will be looking after you or preparing you for your cesarean section. The midwife will ask you for your notes. It's important to have these notes so we can have a look at your history and admit you onto the computer system. Okay, so the midwife will orientate you to the ward. She will show you the toilets and your bed space. You'll then be given a hospital gown to get changed into and an anti-embolism stockings or TED stockings. The midwife will ask you to remove all your clothing and get changed into the gown. Usually the open bit of the gown goes at the back, and it's important that it's done correctly. So when you get to the theatre, the anaesthetist will have easy access to your back in preparation for your spinal. Also, if you want to do skin to skin, we have an easy way of adjusting the gown so skin to skin can take place easily. In regards to your anti-embolism stockings, the midwife will measure your legs to ensure you've got the right size. Okay, the embolism stockings is just to help prevent any blood clots or deep vein thrombosis. So what it is, the stockings places gentle pressure on your legs, and this increases circulation. In doing so, it prevents blood clots or any deep vein thrombosis. Remember, after your cesarean section, you'll be in bed for about 6 to 8 hours, so hence the importance of the anti-embolism stocking. Your birthing partner will also be given scrubs to get changed into, so you'll get blue scrubs like those to get changed into in order to get into the theatre. He needs to be dressed appropriately for access to the theatre. So the midwife will complete a theatre safety checklist with you. She will ask you when was the last time you had something to eat and drink. She'll also ask you, had you taken your anti-acid tablets and your anti-sickness tablets. She will also check your blood results, make sure all your blood results are absolutely normal, and if there's any concerns, obviously that will be looked into more depth. You'll also be given 2 identification bands to put on, one on your hand and one on your ankle. That's just saying who you are. So it will be your name, your date of birth, your hospital number, and your NHS number will be on that identification tag. If you have got an allergy, for example, if you've got an allergy to penicillin or aspirin or any sort of medication, you'll also put a red band to indicate that you've got an allergy. The midwife will also take your observations. This includes your blood pressure, your pulse, your temperature, and your respiration rates. Okay, we just want to make sure all these observations are normal. She will also listen to the baby's heartbeat and ask you how well your baby is moving. The midwife will also ask for a urine sample, so a urinalysis can be done. A urinalysis is a test of a urine to detect and manage any disorders such as a urinary tract infection, kidney disease, diabetes. We also check to see if there's any protein in the urine. So if any of these are found, you will be treated. So you will be weighed on the day of your cesarean section. It's important to know your body mass index, to have a current body mass index on the day of your cesarean section. The body mass index is a measure which uses your height and weight to work out if you've got a healthy weight. And that's so important, because certain medication we do give, we need to know your current BMI, so we give the right dosage. Medications such as Clexin, which needs to be given to you after your cesarean section, based on your weight, we would know what dosage to give. So that is so vital. So if you do have nail polish, the midwife will remove the nail polish, purely because nail polish reduces the ability to monitor you effectively during surgery. So during your cesarean section, a probe will be placed at the end of your fingertip to read the oxygen levels in your blood. The probe cannot read the oxygen level, if you have nail varnish or artificial nails. So hence the importance having it removed prior to your cesarean section. So if you have any jewelry such as rings, bracelets, watch, earrings, any jewelry at all, the midwife will ask you to remove them prior to your cesarean section. There's a major concern that if you're wearing metal or any jewelry during the cesarean section, there's an increased risk of surgical burns because of the use of electrocautery. That's a technique used to seal bleeding vessels and to minimize bleeding or to control bleeding. So it's so important that all jewelry are removed as part of the safety checklist. The midwife will also discuss your birth plan. For example, she'll ask you, would you like skin to skin? Would you like vitamin K for baby? Your intention of feeding. She'll also ask you, would you like music during the birth? And any other requests on your birth plan will be discussed. So once the safety checklist is completed by your midwife and you're all ready, you're all safe for the theatre, you'll have the obstetric consultant doctors coming to have a chat to you. He will discuss any concerns you may have in regards to your planned cesarean section. He will also check your consent form and have you re-sign it on the day. He'll discuss contraception with you. So if you would like any contraception, that will also be discussed. You'll have the time to rediscuss anything you haven't understood with the obstetric consultant. You'll also have the anesthetist coming to have a chat to you about the options for your anesthesia. So usually for cesarean section, women would have the spinal. So the doctors will tell you what it is, the side effects, tell you the position you need to adopt in order to insert the spinal. If you have any questions, you have to ask the anesthetist so he can address any concerns or any questions you may have. You'll have plenty of time to do that. It's not rushed. You'll have a lot of time to sit and have all your questions answered. So once all safety checks are done and you have seen the anesthetist, the obstetric doctors, and you are all ready, the midwife will walk both you and your partner down to the theatre holding bay, where we'll offer you a hat for your head and a warm blanket. Whilst you're waiting, the anesthetic nurse will come to you and do another safety check. So she'll ask you your name, your date of birth, hospital. She'll check your hospital number against your ID band and ask you what procedure you're here for, which is obviously a cesarean section. So once this is done, we will walk you to the theatre to have your lovely baby. So guys, I hope you did enjoy this video. I hope you learned something, and I'll see you in part 3. Thanks for watching. Bye guys.